Yeah. So we are live now.
Uh, Hi, viewers. We are here yet again. And today's topic is COVID-related mental health issues. And I'm Dr. Rajat Hazra from Practo, heading the medical content team. And I would be moderating today's session. Here with me is Dr. Anurag Varma. He is an eminent psychiatrist who has completed his MBBS from AFMC Pune and MD from Grant Medical College, Mumbai. His areas of interest include sports psychology and depressive illness, along with de-addiction. He has a multitude of published papers in reputed medical journals throughout the country to his credit, and is actively involved in building public awareness and dissemination of information through lectures, radio talk shows, newspaper columns, and various other social media platforms. Currently, he's working as a consultant psychiatrist at Emelin Medical College, Prayagraj, UP. So before I hand over the stage to Dr. Anurag, I would request the viewers to like, subscribe, and leave the questions at the chat box. So I leave the stage open to you, Dr. Anurag. You can begin.
Thank you, Dr. Rajat, for the kind introduction. Yeah. Good morning, dear colleagues. Today, I'm going to speak on COVID-19 and its impact on mental health. So, before I start, I'll just give you a brief outline of my presentation. I'm going to speak on the mental health aspect of COVID-19, the common psychiatric illnesses which have been seen post-COVID-19, and steps which we physicians can take to help our patients, and also certain self-care tips that we should ourselves incorporate in our lives, because we all know all of us had been affected by COVID. Before I start, you all know a pandemic has been happening since times immemorial. The first recorded pandemic was the Antonine plague, which was caused by smallpox. And now, 2020, we faced a pandemic like never before. We thought that we are in an era of non-communicable diseases. Communicable disease, infective diseases are now over. But sadly, we got a shock, and it showed how inadequate our medical facilities were. Even the Western society, the US and UK, they were also equally affected. In fact, in India, we did better in COVID-19. So, now just not the COVID-related physical illnesses and death, but also now we are seeing that post-COVID times, the mental issues which have been associated with COVID are now even spreading even now. So it was a global health emergency. It caused more than 1 million deaths less than in a year. And not just physical illnesses, it caused a lot of socioeconomic, emotional, and psychiatric issues, which we are going to focus on today. How did it affect us Indians? Obviously, we all know how COVID happened. We had a lockdown. It caused a lot of socioeconomic upheavals. Frontline health workers like us, if you remember, I'll just share an anecdote. I'm a psychiatrist. The medical college I've been working here in Prayagraj was made as a level 3 COVID hospital. And I got a news that I'm going to get posted in the STU of COVID. And then subsequently, I also got posted in ICU managing COVID patients. Obviously, I had some colleagues from medicine, from critical care with me. But as a psychiatrist, I was also mentally and training-wise unprepared to handle COVID patients in the ICU. It caused a stress for myself also. And this is how it was. All of us were faced with COVID. All of us had to do out-of-box thinking. And consequently, all of us faced stress, and caused even now it is causing a lot of mental health issues. So persons who were economically unstable, we frontline health workers, statistics have been shown that they are affected more than people who are working from home or were not directly exposed. But again, as I said, irrespective of being exposed to the virus, how you took it, how did you take that whole pandemic? People falling sick, dying, led to a lot of feeling of helplessness and mental breakdown all over these societies. Uncertainties related to the virus, failure of our national healthcare system, and lack of healthcare infrastructure set a ripple effect that caused a lot of paranoia and anxiety during this pandemic, and subjective fear and the witnessing of sensational and negative media reports of COVID. And just not COVID, the lockdown would happen because of COVID. If you actually look at it, because of the sheer number of population, yes, lockdown helped us manage our medical facilities better, but that lockdown was not easy. I remember we had psychology students who were staying here with us, who were staying in the hostel, and I used to get calls from them because they got stuck in the lockdown. Girls and boys who were from outside the state, they had no way of going back home. And I remember them panicking and telling that I'll walk back to my, I remember one girl said, I'll walk back to my hometown in Jabalpur from Prayagraj, which is more than around 350 kilometers. And this kind of things happened at the peak of lockdown. How COVID pandemic, is it over yet, or we are still having the mental health issues, is we're going to talk about it today. The World Health Organization has said we are in a good position so that the COVID-19 pandemic ends. We are able to control the virus with vaccination and all. But how about the mental illnesses? Are we ready yet? How does mental health get affected by COVID? As you know, mental health is, we talk about the bio, psycho, social aspects of mental health. So, and COVID-19, we don't know how it is affecting mental health. And mental health, psychiatry is still a topic where where the general people and even us doctors are not very well aware of. There is just not the psychological problems, but the economic problems which are faced by especially the lower strata, the changes in sleep patterns, the lack of healthy behaviors because of the lockdown, because of working from home, the small amount of exercise by going to the office or by meeting people, interacting with them, those healthy habits, they got affected also. The impact of social media, so many of negative news, the quarantine, and the fear and anxiety of not just your own health, but the health of your family caused a lot of mental stress, a lot of psychological issues came out during this COVID. And as I said, COVID actually led a lot of research on how mental illnesses are happening in COVID. Just as I said, just not the psychological factors, but now we have come to be aware of a lot of biological factors of how COVID and is affecting your psychiatric illnesses. As we all know, COVID was an autoimmune disease, and this led to a lot of cytokines, especially T helper cell secreted cytokines. This higher levels of cytokines also, because of the disruption of the blood-brain barrier, led to nerve inflammation. This peripheral immune cell invasion into the central nervous system, which happened because of disruption of the blood-brain barrier, also our gut, the gut microbiota, that got affected, and there were a lot of gap junctions in the gut microbiota, and this cytokines, once they cross into the central nervous system, they affected the normal metabolism that happens in the central nervous system. As we all know, serotonin is one of the principal neurotransmitters which we talk about a lot for depression and anxiety. Serotonin is secreted from the amino acid tryptophan, which is there in the diet, which is produced in the body. And when this process in the brain, there that amino acid is converted into serotonin. So because of this cytokines and nerve inflammation, thus serotonin production in the central nervous system gets converted into kynurenine pathway. And this has been shown to increase depression. If the patient was depressed previously, it led to a lot of relapse. Also, hypothalamic pituitary adrenal axis dysfunction. We talks about dexamethasone challenge test and high levels of cortisol in depressive illness, especially in bipolar depression. So, as you all know, cortisol can be good in the short term, but continuous presence of high levels of cortisol is uh, is poor, is harmful for neurogenesis. That can also be one of the reasons why depression and other psychiatric illnesses happen, and people who were previously depressed had a relapse. Also, microglia activation was seen. A lot of indolamine deoxy induction will happen, and this two pathways was also related to why we have observed that memory deficits, Alzheimer's type of illness, vascular dementia was increased in post-COVID patients who had the severe form of COVID. Also, indolamine induction is related to the tumor pathway also. Maybe later we might actually see that patients who had severely affected with COVID might actually have increased production of, or they might have increased incidence of cancer. This is an ongoing topic. I don't know, but this also is something which we need to be aware of, and how there is a interaction of biological pathways like this, the psychological effect that COVID had, and the social isolation which we had has led to a tremendous increase in psychiatric illnesses. You see this slide which has been published in Nature. Initially, we had a doubling of incidence of depression in UK. The study was done in June 2010. 6 months later, similar study, which when was repeated in the US, we see a four-fold increase in depressive illnesses. And this shows how the biopsychosocial aspect is still lingering on, and we might still not be yet over with COVID in terms of mental illnesses. So to summarize, we saw a lot of post-traumatic stress disorder-like symptoms, stress disorders in COVID. More than 20% patients complained of that. Depression was increased tremendously, anxiety, OCD like obsessive compulsive like symptoms. And a lot of people complained about sleep related problems, initial insomnia, or even if they were able to sleep, early morning awakening, or not feeling restful even after sleep. I did a paper which got published. As I already mentioned, we were the L3 tertiary care hospital, and we asked about our healthcare workers, doctors, paramedical staff, and nurses which were working in the ICU and STU. We had a sample of 224 patients, even though we did this study initially. So we did not find frank depressive disorders, but people did talk about increase in depressive features, increase in anxiety, problems related to sleep, even in our sample in our hospital. Just not these core psychiatric problems. There were associated other disorders also, which had been increased in COVID, and it has been increased even now. And actually, you can understand how alcohol and drug usage increased, not just in adults, but even young adolescents had increased substance abuse once the lockdown was over. And consequently, alcohol and drug abuse can lead to other psychiatric illnesses like anxiety, like panic attack, depression. Domestic violence, this is like a tip of an iceberg. It's always been there in the society because of exacerbation of quarantine, the economic problems and physical proximity to one another, and frustration led to a lot of domestic violence, grief and depression. All of us were affected. I doubt anybody would say that we don't know anyone who lost a loved one in this pandemic, or somebody who was not severely affected by COVID. And we felt very helpless. Even as doctors, we didn't know what to do. That led to a lot of grief and depression, financial losses. Everyone, even doctors who were working in private clinics, they had to shut down their clinics. Even though if you managed to work online, the staff we had, they were not allowed to come. And these people lost their livelihood, and it led to problems for all of us. And again, access to healthcare, medications, and basic services, all this led to a lot of mental health issues, which we are even seeing now. A lot of depressive disorders, bipolar disorders, panic disorders, as I mentioned, generalized anxiety, which is characterized by like excessively worrying, unable to sleep properly, unable to concentrate, leading to poor performance in your profession. Students, how you yourself see that so many students, they were affected by COVID. Online studies were not the same as going to the classroom, having an interactive session with the teachers. And once they were faced with exams, they used to have a lot of anxiety related to the exams, related to the interviews. All this was there, actually affects the whole family. They come back, the parents are worried about that, and all this happens. As I already mentioned, bipolar disorders is something where we have an episode of depression, and then we have an episode of mania, which is characterized by grandiosity, increased talkativeness. And as I'd already mentioned, the biological causes, the cytokines, the inflammatory pathways, those sort of precipitated bipolar, and hospitals weren't functioning. So staying with a patient, not knowing what to do, all this led to a lot of familial stress. Disorders of behavior, obsessive compulsive disorder, where we have a lot of checking, we have a lot of washing. After, like, once I finish my talk, we can actually discuss on all these disorders individually if you all are interested. Children and adolescents, something we call it as externalizing disorder. Externalizing disorders we mean by temper tantrums, by disruptive behaviors in the children, and they didn't know. They lost their friends, they lost their playrooms. And this stress, since they are not so psychologically minded as adults, and they don't know how to express the angst which they feel, and this comes out through poor behavior, through disruptive behavior, temper tantrums, through conduct disorder, and I'd already mentioned even dementia, Alzheimer's disease, vascular dementia, because COVID caused a lot of thromboembolic phenomena. And even in the central nervous system, it led to the neuroinflammation, led to poor nerve growth factor, poor presence of brain-derived neurotrophic factors. This led to decreased neurogenesis. And this was one of the reasons why we are still seeing a lot of memory-related issues which is happening post-COVID. Even post-COVID era, there's this meta-analysis, which is a very, very new meta-analysis. It's just come out in October 2022. We have seen that, yes, as compared to the peak of COVID, which happened during March and summers of 2020, there is slightly less incidence of anxiety and depression, but still it is there. However, post-traumatic stress, acute stress disorders, the psychological feeling of distress, suicidal ideations and completed suicides, substance use, they are still there, much higher than the baseline and not much decrease as compared to the peak of COVID. And this is something we should be aware of. We should be actively asking our own patients and take care of. Patients also now have more depressive symptoms as compared to pre-COVID levels. High prevalence of anxiety, depression, PTSD has been seen more in certain areas like North America as compared to Europe, whereas Europe and India, here, like, patients are more complaining about sleep disturbances and anxiety as compared to the Western society, America, where there is a more incidence of depression and PTSD-like features. So slight difference in cohort, how this happens, how this develops. This is still a subject of ongoing research, and we'll know more as time goes on. Who developed this neuropsychiatric complications more? Interestingly, research shows that patients who are already diabetic, hypertensive, who already had compromised vascular brain disease or suffered from coagulopathy, they had more psychiatric illnesses. And vice versa also, patients who were previously had psychiatric illnesses like depression, like schizophrenia, like OCD, they had more medical comorbidities. And we can very well understand, even in normal population, the incidence of depression is twice as much in diabetes as compared to normal population. Because, as I said, again, the biological causes, also neuroinflammation is seen in diabetes, and also psychological causes. Because in diabetes, the only exercise you used to get, maybe going from the office, maybe going from the work, because of constantly worrying, stress leading to increased blood sugar levels, all this had interaction. Hypertension, as you also can understand. So there were a lot of comorbidities which led to psychiatric illnesses, and psychiatric illnesses which led to increase in medical comorbidities also. As you can see, psychiatric illnesses led to associated PTSD. PTSD, there was a study done, 33.5% of patients who had psychiatric conditions. A lot of them complained about PTSD at 4 weeks follow-up. And as I said, psychiatric illnesses have incubation period, and this is still persisting and increasing. So associated patients' psychological vulnerability and the traumatic of impact of the disease leads to high prevalence of COVID. Do we have certain recommendations of screening for mental health warning signs? You don't have to be a psychiatric expert or a psychiatrist. Even if you're psychologically minded, patients come into your clinic. If you just ask certain questions, and if you think, okay, this patient might be having a bit of anxiety or depression, you can just give him a question. You can download it from here, or there are a lot of questionnaires available on the internet. You can just ask him to, okay, go fill up this form, or you can ask yourself or your helper to just ask certain questions like, do you feel depressed? Do you feel lack of energy, not wanting to go to work, stay in the bed all the time, is going to help you diagnose and become aware of psychiatric illnesses. This slide I've said, which covers a bit of depression, it covers a bit of acute stress disorder and anxiety, the feeling of performing daily activities, recurring nightmares and intrusive thoughts. What happens in post-traumatic stress disorder is that if we have something which has impacted us psychologically, we keep having ruminating thoughts about that. We avoid going to places which reminds us of illness. We avoid going to the hospitals. We develop phobia to it. We have a lot of dreams related to that theme, and intense panic attacks which happens. And these questionnaires summarize some of those. And if you give it to your patient, if you ask these questions, you can come up with a lot of psychiatric complaints which the patients are reluctant to share with you. Once they say that the doctor has time, the doctor is listening to you, and then they open up and talk about psychiatric illnesses. We can actually talk about self-harm, which has been seen. We can talk about certain suicidal ideations. Unfortunately, we had an increased incidence of suicide also post-COVID. And as I already mentioned, a lot of drug and alcohol abuse has increased, especially in young people, in adolescents, and not just alcohol. Alcohol is a triad which leads to increased suicidality. The triad of depression, alcohol abuse, and suicidality leads to so much of harm to the society. We have already seen it in the media that incidents of suicide has been happening. Who all are vulnerable? Who we should specifically ask these questions are people who have been discharged from an hospital, both because of medical reasons or because of psychiatric illness, or patients who have had a recent diagnosis of major mental disorders. These patients are vulnerable. Patients who are schizophrenic, who are depressed, who had suffered from bipolar depression, or if there is a family history of depression or a recent loss of a family member of COVID, these patients are more vulnerable to psychological issues, and we should make sure that we talk about psychiatric issues in these patients. It is recommended that screening of mental health alarm signs for depression, anxiety, acute stress, suicidal risk, and substance abuse should be asked. It is recommended that it should screen and provide support for workers who have some type of physical or health-related issues, because as I've already mentioned, these patients are more vulnerable. And psychiatric issues are like one is related to the other. You have a psychiatric illness and you have a lot of comorbid issues according with that psychiatric illnesses. For example, a patient who has obsessive compulsive disorder, a lot of OCD was precipitated during COVID times. These patients used to come and they used to use so much of disinfectants and so much of soap that a lot of them actually developed skin problems. And they got a reason of justifying their behavior, not sort of trying to solve it. This actually led to a lot of family discord, and they had this demanding dependency. Not only they insisted that they'll do it, they started forcing their family members to adopt their pathological behavior, and led to a lot of discord, a lot of other psychiatric illnesses like depression, like anxiety, like panic. So we should be aware of how psychiatric illnesses just not affects the person, how it is exacerbated because of the psychological issues, but how it sort of affects your family members too. Again, patients who actually lost out on loved ones and all, they uh, they felt guilty because of it. They didn't know how to sort of manage their griefs and MDD, depression. A lot of times they actually sort of complained of that, and they were not ready to come to you for help because they felt ki, okay, I'm okay. Like I'm the one who should be stoic, who should be strong. As from this example, you can see, but they actually require a lot of psychiatric help. So if you see cases like this, be free to refer these patients to proper psychiatric screening. What can be initiated? We should always talk about patients on being going good things, being healthy, should always exercise, should always try relaxation therapy. Mindfulness meditation is something where even if we have a lot of worries and anxieties going on in our mind, we talk about patients that we should not actually keep thinking how to do it. If we can just observe our thoughts with a neutral mindset, with a relaxed mindset, ultimately these thoughts go. Cognitive behavioral therapy, worry scheduling, why worry scheduling, something as simple as if you just like take a copy and pen. At the end of the day, you just note down, okay, this needs things to be done, but now it's a time for me to sleep. I'm not going to worry now. I'm going to just take care of if I sleep well, if I can just go for a small walk, come back, think about good things, and I'm going to worry again tomorrow morning. This small steps, diary noting, writing down what are the problems, how negative thoughts are affecting us can give us a framework where we can actually help ourselves also. Reduce time spent in reading about catastrophic news or worrying all the time. Have a positive outlook in life, and if required, talk to the medical aspects. There are certain self-help groups, patients who are into addiction or even otherwise. You can talk to people. A lot of suicidal helplines the government of India has come up with. So if you feel that you are having these kind of thoughts, feel to call up, talk about it, and this is definitely going to help. As I said, how long do we need to talk about mental health issues post-COVID? Earlier, PTSD, we used to say that 6 months is usually like PTSD symptoms usually come. But now we have been seeing, as I already mentioned in COVID, that we need a long-term mental health perspective post-COVID. People are still coming up with corona phobia, people are coming up with panic disorders, with depression. And it has been recommended that not just now, but even post like 2 years, 3 years, we should be psychologically minded. And patients coming us, we should talk about any psychiatric or depressive features which they complain of. It has, as I said, just not patient, it has affected all of us. And small guidelines which were effective for patients, we should also be guarded and we should take care of our own self. If you are healthy, then we can take care of our patients themselves. And there have been studies which have shown that physicians who are stressed make more medical mistakes. Our staff, we should also take care of, especially ICU staff and all. They have faced the brunt of COVID. They have psychological issues. So if we have to take care of ourselves, our staff, especially those workers who are in ICU, who were intensely exposed to COVID and the deaths which happened because of COVID. So healthcare workers, they should also have a medium and long-term plans of taking care, personal reasons. They should understand the social impacts of COVID. So word about the self-care of health workers. There are some recommendations which are coming up. Obviously, these take times. I've written week recommendations. Not that week recommendation means this is an ongoing study and we are going to come up with a protocol very soon. It always take out at least 10 minutes every day for us to just go walk, exercise. We should again reorganize our daily routine, get back to our friends, take time out, just spend time being happy with family, the relationship. Good eating habits and sleeping habit always helps. As I had already spoken about, tryptophan is converted into serotonin, and serotonin is something which we might term it as a happy hormone. Tryptophan rich foods, omega 3 rich foods like fish, like chicken, like spinach, like almonds, dark chocolates, they have a lot of antioxidants. Uh, Fatty foods, fats which are very saturated, rich in saturated fatty acids, those are not recommended in our diets. So these small things, having a healthy breakfast, all this helps improve our cognitive function, helps increase our attention and concentration, and helps in the decision-making process, which for us is so important, but because that can have a trickle effect right down to our patients also. Include leisure activities, take a break, go for holidays, keep increasing your motivation, and have a good work days. Uh, uh, Emotional management, deep breathing, yoga, exercise, all this helps. Participating in group activities. I remember like just on 2nd October here, we organized a cyclothlon by the Indian Medical Association. Uh, we were the host. I was also one of the organizing members, and more than 100 doctors participated in the cyclothlon, which we organized. We had a 30-kilometer cycling race for ladies and 50 kilometers for males. And you would be surprised that more than 100 doctors actually completed it. And people, like said, people all over from India came over. And something like this, just to take our mind away from the routine work, helps. I'll be coming to my last few slides. All of us have lost or who had actually lost our loved ones. And in COVID times, you've seen certain losses happen where the bodies were packed, they were sent for the cremation. They were not even like the normal grief which was happening, where we talk about relatives, where we have support. Here, what happened was the pain would happen because of loss of very personal and solitary. A lot of ruptured social cohesion. People knew that this family needs help. They are down with COVID, but people were scared to come out and help. And this all becomes so overwhelming. A lot of people had self-blame. We couldn't do anything about our loved ones. Uh, Stoic emotions, not being able to share, or heightened emotions. All this led to a lot of grieving and PTSD. The small steps we can help people who have lost the loved ones is by creating a safe space for them to communicate. Allow that person to talk about the disease. We can talk about, okay, the breadwinner, like suppose the breadwinner has lost. What does the mother do who has got small children? It's not that we do not talk about it. We can talk about restoration, how they can again think about the future order. And just like small companioning, walking around, listening to the daily problems which we have, the pre-grief such thing, staying, just 1 second. Hello. Hello. Yeah, just not just how big an expert you are, just the nuance of how you communicate, just the tenor. When the patient feels that doctor listens, he understands, that itself helps a lot of time in grief reaction. I've seen a lot of people say, Ki, this happened, I lost this person, but you haven't told the children. Even 6 months after this things happened, they haven't yet disclosed to the children. Always remember, children have an inherent belief in truth. Talking about like understanding their psychological perspective and gradually telling them, okay, this has happened now, this is how we are going to go about it, helps more than just constantly telling them, no, this has not happened, not allowing them to focus on it. Religious rituals. When I was young, I always used to think the rituals which we have, like suppose somebody dies, where we have Havan, or we have Terai after 13 days. Why this? Because nobody feels like having food. But now it's been shown that if the patient comes out, just discovers that, okay, life goes on, he just meets people, he can actually pray. That all helps overcoming your grief, overcoming your PTSD. So my last slide, this is a very famous Harvard studies where the patients were followed up right from their birth till 80 years, and study is still going on. And it has been shown that good positive relationships are something which is one of the best guards in preventing psychiatric diseases like depression. There is no point in sort of going for searching for happiness, but enjoy yourself, have a healthy relationship, and again, have a healthy body. Be flexible in your day-to-day activities. Be flexible. Expect that there will be certain times which would be tough, but if you can get over it, you would come out and again sort of get back to life. Thank you.
Thanks a lot, Dr. Anurag, for this really helpful presentation. And right now we'll be taking some questions which are coming from the viewers. There's one question which specifically asks, have you seen any instances of many mental health problems manifesting physically? I think you've already answered it. Nevertheless, I'll just reiterate those points. Correct me if I'm wrong. So from what I understand from your presentation is definitely there's a psychosomatics, both psychological as well as bodily manifestation of the various things. And you have clearly mentioned that neuromessengers, specifically cytokines, create a sort of inflammation which disrupts the transmission from the brains to from the nerves to the brain. And this is, if I'm not mistaken, it's a kind of cytokine storm. I mean, there's a excessive, disproportionate amount of defense. I mean, this is the body's defense mechanism to protect itself during COVID times, if I'm not mistaken. As a result of which, the happy hormone, serotonin, gets it's not produced to the optimal level, leading to a variety of mental disorders like anxiety, depression. And there is an interplay of not just the chemical transmitters, but there is a kind of interplay between socioeconomic factors, disruption of these neurotransmitters and other aspects, which leads to various sequelae of mental as well as bodily disorders. And some of the physical disorders as well as mental disorders that you have mentioned are anxiety, sleep disorder, suicidal ideation, though you have clearly and categorically stated that the manifestations in India is a little bit different from that seen in US and European patients. For example, anxiety and sleep disorders are more seen in Indian context, and suicidal ideations, post-traumatic stress disorders are more seen in the European and American variants. And just to make things simpler, post-traumatic stress disorder, or PTSD as it is known, is associated with flashbacks and nightmares. And you've also mentioned OCD, depressive disorders, bipolar disorders, Alzheimer's type of memory disorders, vascular related memory disorders, drug and alcohol, substance related disorders, substance abuse disorders, domestic discords, extrapolation of the person's individual problems onto the family members, and elements of panic attacks, domestic violence, all these kind of things. So one question the viewers want to know is, which is the most common psychiatric complaint that you have faced during this COVID period?
In Indian studies, even like the study I did, depressive disorder, anxiety disorder, and insomnia, especially going to sleep. These were the commonest three problems which have been complained of in my patients coming to our OPD. Initially, we had certain depressive issues, but now, as I said, now all psychiatric illnesses have an incubation period. Now patients, a lot of time they are coming with frank depression. And you mentioned psychosomatic issues. India, unfortunately, especially the rural population, they are not so psychologically minded. They do not come up and say that, doctor, I have depression. They'll come up and say कि मेरे को काम करने में बहुत जल्दी थकान हो जाती है. I don't, मतलब मन ही नहीं करता, ऐसे लगता है कि बॉडी को किसी ने निचोड़ दिया है. These are the kind of complaints that they come up with. बहुत थकान लग रही है, जो काम हम फटाफट कर लेते थे अब वो होता ही नहीं है. They feel guilty. Mothers come up and they say कि हम अपने बच्चों का खाना बनाने का ही मन नहीं करता है. त्योहार आ रही हैं, I don't feel like celebrating. So these are the kind of complaints that they come up. They are actually telling you that they have depression. As I said, stress-induced headaches, a lot of time, backaches, shoulder aches. Yeah, even like I did not mention it, but all these anxiety features actually lead to sexual issues also, especially in young couples. Males not feel like having sexuality, which is a very normal part of our lives and it should be encouraged. And issues like premature ejaculation, erectile dysfunction, even this is coming up. They do not complain to you directly, but if you ask them, they definitely come up and they feel actually happy कि doctor, you did ask and now we are willing to share with you. So a lot of psychosomatic complaints, all kinds of psychiatric illnesses, we should be aware. And if we ask, then the patient themselves start sharing and we see so many psychiatric complaints which have been happening. As you already summarized so well, it's everything and everything.
Right. And I also understand from what you just, how you responded, that there may be a variation between the rural and the urban population. And it's up to the physician and the psychiatrist to probe for further details. It's screaming for attention. Maybe some of the patients will not be able to, voice out in exact articulated fashion, but probing is very important. Doctor, another question that I have is, psychiatry, the specialization developed in the Western world. And one of the reasons probably this is, personally coming to in my mind to me is the fact there are hardly listeners in America and Europe. So basically, I mean, this is a concept, I may be wrong. Whereas in India, there is no dearth of unsolicited advice. You have mamas, you have mommies, chachas. The entire neighborhood is, willing to listen and give you advice. So, do you think, some of the viewers might wonder that we have family members, we have spiritual gurujis, and we have friends to fall back upon, stressful times. So, do I still need to go to a specialist to address this issue? Can these people substitute the place of a specialist? I just want you to, emphasize on this fact to the viewers so that they can tease out the facts from myths.
Yeah, this is a very interesting question because certain disorders, we have, especially I'll give an example of schizophrenia. What happens in Western society, schizophrenic patients do not do so well because they are absolutely isolated from the society, from their family members. Here, especially in the rural population, we have seen schizophrenic patients doing quite well because they do not lose their job. Unstructured work, farming, or like work which do not require a lot of expertise, they keep on doing it as if they had it before the illness. So this helps. Even like certain problems like anxiety, if it is not much, just having somebody to have a shoulder to lean on. As I said, in fact, COVID, because of this disruption in the social structure, all right, this led to a lot of anxiety. So anxiety, acute stress helps by talking out. If there is somebody who's just listened to you, it helps. But now sometimes it happens in the other way around also. Lot of myths, lot of ill-conceived advices also sometimes happen. कि अगर आपको ये हो रहा है तो ये हो जाएगा. My God, if you're having this, as I said, psychosexual issues in young people, so many myths in India. ये आपको हो रहा है. That syndrome is something which is like exclusively seen in India and Southeast Asian, where normal sort of ejaculation which happens sometimes in the night has been related with so many things. Ultimately, the patient thinks he might actually die. Even lot of time, patient who have dissociative disorders, like in India, this is also something which is very interesting. Uh, Suicidality is actually seen more in men as compared to women. But in India, the ratio is equal. In fact, sometimes women commit more suicide than men because they do not have the freedom. All right. Females, they get married. They keep on like 24 hours. Like women here, women physicians would understand this also. During lockdown, they were supposed to do their office work, but they were not. They were again overburdened with taking care of children, and they had to also take care of the household stuff, managing the office, managing household work, managing children, all at the same time with the loss of domestic health. Obviously, this was like so stressful and a thankless job also. We did talk about men helping, sharing household work, but it was more on like say WhatsApp, taking a photograph. But once it came to the daily nitty gritty, women had more burden, and obviously this would lead to increased stress, and consequently over a period, long term, we thought ki, okay, lockdown 15 days, things are going to be okay. Then that lockdown increase kept on happening 3 to 4 months, and then you don't know, you feel trapped, you feel languished, you don't know how to come out of this trap. Then psychiatric illnesses, they start coming up. This is how it happens.
Right, right. So basically, talking to family members, friends, you are suggesting it helps, but it cannot substitute a specialist help.
Yes,
And sometimes,
yes, yeah. If you have stressors, acute stress disorder, or if you have adjustment disorders, it helps. All right. But if you have a pure psychiatric, if this actually develops into depressive disorder, if this actually converts into post-traumatic stress or obsessive compulsive disorder, or if you start having severe recurrent panic attacks, then I think proper reference and proper psychiatric care,
so the bottom
helps.
line, doctor, is for the patients to seek professional help, and this can go on simultaneously, help from friends, because they won't be able to distinguish between a serious psychiatric illness or a milder one. They would be reading stuff in social media and will be waylaid from the actual facts.
Exactly.
So, doctor, so far we have been talking about adults, and I gather in recent times, due to social media awareness and other factors, that slowly that stigma about mental health is going away, if not completely gone. There was a point of time during my childhood. I mean, visiting a psychiatrist would be looked down upon. Pagal.
Yes.
It was inevitably associated with pagalpan and all those things. So my question right now is, you did mention about children also getting affected due to mental, illnesses in the form of disruptive behavior, conduct behavior, and externalizing perhaps that social isolation, not being in school. So how seriously are parents actually taking their children? Because they might be thinking, "Bachcha hai, usko kahan se depression?" Because the moment psychiatric illnesses come into a adult's mind, they will be thinking in terms of broadly, depression, anxiety, panic, and they tend to, just neglect. Bachcha hi to hai na, isko kya problem hai? So do you think in your practice, parents have actually started taking this aspect seriously about their children and approaching psychiatrists?
Yes, there has been, I'll still say it is less. Children do not come directly to psychiatrists. What happens is that a lot of times school difficulties happen. The child is depressed, and it reflects in poor school performance. Then the child starts having complaints like headache, like nightmares, unable to sleep. So they usually go to an ophthalmologist, they go to a neurologist, and ultimately they come to psychiatrist. And the good thing I've seen is once the patient comes to a psychiatrist, if something similar happens in family members or in someone who they know, then they advise, and then these patients are coming directly and sooner for psychiatric help. So this is one positive change. Children would, as I said, they're not so psychologically minded. They do not complain of depressive or anxiety disorders. They'll complain about nightmares. They'll have temper tantrums. They would either have that, very small children have this clinging behavior. They do not want their parents to leave and go for work. So these are the kind of problems which we have to actually go and dissect and then find out, okay, the child is suffering from separation anxiety, the child is suffering from, and this is something which is very interesting. And this year's like World Mental Health theme, the October 10 was a World Mental Health Day, and they did come up to make psychiatric and mental health issues a global priority, increase awareness. And as I said, I'm here talking on Practo. Deepika Padukone on October 10th, she came up that she suffered from depression. And this is something which is okay. You should go seek psychiatric help. So these small initiatives go a long way in increasing awareness and making people understand that psychiatric illnesses are just like other medical illnesses, and medicines now are safe. You should come out of that fear of being labeled, as you said, pagal, and should tackle things. If you tackle it as soon as possible, obviously the results are going to be better. If you're going to have more and more recurrence, and then you go and visit a psychiatrist.
So, Doctor, in order to take it from the adults to the children, now I'll bring the same question in relation to frontline health workers. So you did mention somewhere during your presentation, there was an increasing, trend of the same problems occurring among the frontline health workers. So I have noticed as a doctor, the doctors themselves tend to, neglect their own problems. So do you see a change, amongst physicians or even psychiatrists? Because sometimes we tend to, self-prescribe, being doctors ourselves. So do you see a trend, a change in trend where doctors are reaching out, or even psychiatrists are reaching out to other psychiatrists seeking help for this post-COVID, development of disorders?
Yes, and COVID actually helped increase the awareness. There have been more physician references to me, definitely. Being in the medical college, I have so many of colleagues, and a lot of depressive anxiety issues, as I said, insomnia. They have been complained about by my colleagues, and they have come out and asked for help. And as I said, no, doctors are also getting aware. I mentioned about cycling, about exercise, about social activities. There have been an increased trend about that. Also, I'll mention that there was a study done. There was this study done in PGI Chandigarh, where they have actually gone and looked at the issues, and it has been shown. I had mentioned a bit about it in my slide also, that ICU workers, people, healthcare workers who were exposed more to deaths, who were even more vulnerable because of their work, being exposed to COVID, they had more mental health issues. Doctors and nurses who were in the junior rank, because they actually felt that they have been forced to do it. They do not have control over them. They did not know how soon that rotation is going to happen. And they actually felt that slightly overwhelmed also, because they felt we are not trained as well as our work requires. So they had more PTSD, they had more depression, anxiety, as compared to senior doctors, or as compared to people who, by virtue of their specialty, was lesser exposed to ICU work and COVID work. I mentioned I myself being a psychiatrist, but I did a ICU posting in COVID times and SDU posting after that, once they understood that a psychiatrist is better off not managing the acute cases. But once that the pandemic happened, we were so short of workers, and it felt good also. Okay, you are able to contribute in a small way. My wife, she's an endocrinologist and a physician. So I used to always, my father is also an MD medicine physician. So I used to always be on the phone asking them, what do I do? And I managed to learn. So you have to be flexible rather than actually thinking, ki ab kya hoga, and feeling overwhelmed. So even I faced the crisis, but since I managed it well, I think I did well. So personal experience also.
So, Doctor, linked to this question, I have an interesting personal question.
Yeah.
And the question is, as a psychiatrist, whom do you find it easier to treat? A healthcare worker, including a doctor, or even a psychiatrist, or a patient? And I'll tell you the context behind this question. I come from a gynecologist family. Both my granddad and dad were gynecologists. And during my childhood, from my childhood till adulthood, I've realized one thing. It's a sweeping generalization I'm making. It's very difficult for a gynecologist to deal with another gynecologist. They create a lot of problems. Is it a similar situation in psychiatry, or whom do you find more comfortable to treat? Do patients listen better to you, or other psychiatrists listen better to you?
Oh, wow, this is something like I've never been asked before. But yes, I'll tell you, doctors are not very good at their own self-care. Okay, they did, even if they start, they sometimes do not sort of finish it. As we all know, okay, there is a certain course of an antibiotic. All right. So similarly, there are a course of psychiatric illness. You have to take treatment for say so long. Single depressive episode we recommend it for at least 1 year. If you have multiple episodes, we ask them to take it sometimes even lifelong, certain medications. Yes, psychiatrists are bad in that. All right, we tend to sort of do not follow through on instructions, especially acute crisis. Everybody is a patient, but once that acute crisis goes, sometimes we doctors and psychiatrists ourselves do not sort of see the treatment through. We do not, as I talk about insight, insight is something where we understand the illness and we take steps so that that illness doesn't happen again. So we lack complete insight. I'll say ki us personally, I would not give 5 out of 5 on insight for us. I'll say it is closer to 3 or 4 out of 5 because the, the precipitating events and the causes and our own contributory unhealthy habits, unless and until that gets taken care of, we're going to have that problem again and again. We often tend to miss out on this. Here, patients, especially from the rural population, they are better. I still remember, like, there are certain patients, they said they came back from rural background and they said, doctor, आपने बोला था कि वो दवा आपको चलाते रहना है, तो हम आपके पास 1 साल आ नहीं पाए, बट वो दवा किसी तरह से करके आधा करके ये करके किसी से पूछ के किसी को रिश्तेदार को भेज के हमने मंगा लिया और हम करते रहे और हम ठीक है, अब हम आपके पास दोबारा आए, अब क्या करना है. So in that way, sometimes rural patients actually do better than people who are better at it because they tend to believe and follow.
Doc, I'll share my own personal,
please.
Statement. There's a statement which I've created. Advices are given best by those who need it the most. So in context to being a doctor, you find doctors who are chain smokers, yet without batting an eyelid, they will tell the patient, और वो भी डांट लगा के अरे ऐसे सिगरेट पीते हैं. And I mean it's not true for everyone, but most of the times. So this is one thing, and I'll shift to another topic. Increasingly we are hearing this term called pandemic fatigue syndrome. So I have a vague idea about it. Is it a accepted entity? And what are the presenting symptoms, if any? Fatigue is there. It gives a rough idea. It has to do with tiredness, indifference, or apathy towards work, and excessive sleep or something like that. So could you please shed some light on this topic?
This term, it's like languishing, sort of similar term that has been coming up. So one other interesting feature is like corona phobia, but like it has been now less, and it is like other phobias. We have very commonly blood alcohol, blood hospital phobias, and agoraphobia. So similarly, even this languishing, where patients and colleagues, they come up and they say, yes, we are doing this work, but we are not able to sort of fully feel connected, fully feel engaged in our work. This, as I said, this happened in a lot of time in people who were working from home, especially in women colleagues. What used to happen was, as I said, once we used to go into the office, we used to be in the professional. Our mind used to be focused. This sort of got disrupted. So the advice here would be, once, like even if you're working from home, suppose lockdown again happens or something similar kind of situations. So you should actually talk to your family members, tell ki now make a room different. Like right now, like I'm sitting in a room which is different from my normal OPD room. Here, like I'm in a mood like, okay, I'm talking and I'm not doing OPD work or I'm not interacting with students right now. So once I finish, I'll go back to that mood. So similarly, they should make an office space. Once they are there, the children and the family members should understand that here they are working in an office similarly to what it used to be before lockdown. Okay. You should, that used to be sometimes the only exercise which used to get. Walk to outside our home, go to our office, walk stairs. This got disrupted. As I said, I'm here working. Suppose my child comes and says, I want this. Or suppose something, please do this. So this happened. So their mind, like they used to be continuously working. There used to be no separation. All right. And as I said, people initially thought, okay, work from home is so easy. I can wear a pajama and work. But they forget that temporal boundaries, that got disrupted. Again, people who are working like engineers, software workers, okay, that timeline, uh, uh, people who are in North America, like they sort of people who are into work where they have to do night shifts, but morning also they do not get enough rest. So we should take care that even if you're working from home, so that languishing feeling should not be there, because you have to maintain temporal boundaries. We should take breaks. Even if we are working at home continuously, we cannot do it. Maybe just have a coffee break. We can, as I said, companioning, I mentioned a word. You can say, okay, what are you doing? Like, I'm having a coffee. You do not have to share exotic holiday location photographs and all. If you're feeling down, I'm not feeling like, why, kya hai? Let's share. We can talk just about it. What are you making? So this kind of companionship, this kind of making temporal boundaries. And again, as I said, people expect the working from home is easier. You can work even more. Instead of 8-hour shift, you can do 12-hour shift because you're staying at home. No, this is wrong. Actually, a study has been done and it has been found out that optimal working time at home is actually lesser than once you're in the office. Not more than 3 to 4 hours. Right. All right. And we can do a 3 to 4 hour shift, take half an hour coffee break where you can actually have a Zoom meeting, just like chit chat, enjoy yourself, take your mind away from that work, and again come back and work for say 2 or 3 hours more, and that's it. Senior managers should actually understand and actually schedule things so that it incorporates that you have working, but you have to actually take care of home. You have to actually take care of more burden that has happened because of this lockdown and this pandemic. So all this is very, in fact, managers should actually, this is a very, very good point, and it depends on the management that how they should take care of their office efficiently.
Right. Dr. Anurag, there are a few questions coming from professional doctors and psychologists. So we'll handle a few more questions if you don't mind. With your permission,
pleasure.
Go ahead. So before I take the doctor's questions, I have one question here. There is something called doom scrolling. As you mentioned earlier, people tend to read the negative news more than the positive aspects. What is your advice to these doomsayers? How do they mitigate the problems? I mean, people are inundated with social media stuff, Facebook, Insta, and they are all the time scrolling through the negative news. So what would be your, easiest mitigation pathway for these?
Yeah, this happened. Like the example like I'll give is, so unfortunate with what happened with Sushant Singh Rajput. He was a case of bipolar depression because of this lockdown. I think he missed out on his medications, addiction, and then I said the deadly triad of depression, hopelessness, and substance abuse actually led him to have suicide. What has it advised? The government advisory is they should not highlight these kind of cases. Should not keep on showing faces. Okay, this person, not glamorize it. Because of this, unfortunately, you read that after this happened, so many young people actually committed suicide. They took their own lives. So we should be aware. There are so many, as I said, we call it as MMPOG, multi-player role-playing games, which are there in the internet. Okay, they are tend to be very addictive. And because of the lockdown, children getting easy access to internet, they're having their own dedicated laptops and smartphones. I've seen children like 6 hours to 10 hours continuously on the internet, playing games. They had a society of themselves absolutely cut off from the external environment. And there was this report in Lucknow a few months back where a child actually shot his mother because she sort of objected that no, you should stop your internet. He said, no, I cannot do that. So internet addiction is also very much there. It's increasingly becoming more common, and sensationalization, because TRPs are meant so that like you have more screen time, you have more viewership. So you do not understand the mental health aspects of it. There should be advisory, there should be a guideline. Parent should take care that not more than 1 to 2 hours of screen time should be allowed for kids. And role-playing games, MMPROG, PUBG, and all these kind of games, parents should keep a watch. We did speak about, I'm not getting that term, like blue whale or something, dark websites.
You're right.
Yeah,
Blue Whale.
yeah,
That
blue whale.
particular game gained notoriety around 1.5 years back during COVID time, and
Yeah.
young children were committing suicide as a part
Yeah.
of that.
Yeah. Children don't know. Matlab, there are predators on the net. Parents should actually monitor. There should be parental filters. If you are giving a young child a smartphone, you should actually have parental filter where certain websites are not being able to be assessed by the children. Parents and childs are not even aware of how much time they are having on screen. You should have certain apps which actually can give an awareness. Okay, this much of time has been already been spent. Okay, we should actually actually monitor our children definitely before just allowing them unhindered access to internet. Internet is definitely useful. It is going to be there, but unhindered use of internet is harmful, and it has already been shown so.
Doc, you did mention earlier that there are self-help books, self-help groups.
Oops.
I mean, in America, you have self-help groups for almost every ailment you could think of. So, what would you suggest to our viewers? Which would be the right method to reach out to these, self-help groups related to mental health disorders?
This is something like when I was in grad medical college, we had an alcoholic anonymous meeting which used to happen. This helps, especially now that we have internet, we have smartphones, laptops. I think self-help groups are definitely helpful, not just in addiction disorders like opioid use, alcohol. It should actually help in tackling phobias, in panic reactions, even in obsessive compulsive disorder. Self-help group where we can just talk about our illness. We can actually see other people are having similar illnesses, and it helps in self-motivation. Okay. Today I did not.
My question was, how do they find out these self-help, groups?
These are there. Internet. If you can actually go type out Alcoholic Anonymous or Narcotic Anonymous or OCD help group, even suicide helplines are there. So all this is there in the net. The government has taken an initiative. There are certain NGOs which have come up with it. If you just go type, you would come up, and this helps.
Okay. So, Doctor, I'll take up a question from Dr. Trupti Desai, who's a clinical psychologist and working as a school counselor. The question is, and I quote it ad verbatim, I have observed the children are also the victims and many behavioral and academic issues are manifesting in them post-pandemic. Her question is, how can we deal with these sort of issues?
As I said, children, first of all, as you said, online learning was not the same as school learning. All right. So we should understand that children would not be performing as well sometimes. All right. The other problem is children who are anxious or who are depressed cannot concentrate on their studies as much. Okay, depression is coming out sometimes with school problems. Oh, the parents themselves being more busy because of economic hardships, they're lesser able to sort of take care about children. So we should first of all understand is the scholastic difficulty happening because of certain underlying issues. Just go talk with the children. Children sometimes act out. Okay, sometimes they uh, uh, tell you about their psychiatric illnesses through non-verbal cues, whether they are playing as much, whether they are interacting as much, whether they're sitting isolated, whether, as I said, clinging behavior, not allowing the parents to move out. Okay, complaining a lot of somatic problems like headache, backache. Children below 10 years coming out with headache, you should actually always ask, is it headache or is it something else the child is not able to communicate? Also, as I said, children are also not getting a break. Their school, their playgrounds have been taken away. Their friends have been taken away all the time with adults. So adults' problems actually get sort of mirrored by children. A lot of stress at home. Children are exposed to it. Obviously, this is not going to help your children. So try to sort of change the atmosphere now. Let the child actually go out, play, enjoy himself, and sit with the child, give him time, get back to his basics, which he has missed for the last 1 or 2 years. Okay, even if the child is not performing as well in studies, don't be excessively worried. If your child is intelligent, go back, work on his basics, work on his confidence, go see if he has enough friends in school, if he's not being bullied by other children, or he's not being absolutely isolated, not talking, not having friends and all. If these issues are there, and studies should always remember more than studies, how well you study. If you have studied today, have you done revision or not? So once you revise, the revision protocol is also there. If you say study for say 40-45 minutes now, take a break, again have another 40-45 minute session, and just as your child is going to the school or as he's just back, just go through what he has studied the previous day. See how well his concepts have come up. So if you work on the basics, your child is actually going to improve gradually. And once he does well in studies, once he is healthy, happy, eating well, again, see, like so many children, because of rushing to the school, they do not have proper breakfast. They just go to school. So focus on these small issues, and the children is actually going to do well in studies also.
Right. Doctor, there's one more question by a doctor who goes by the name of Ray of Hope. And the question is,
Okay.
what would you suggest to physicians who already are suffering with post-COVID, mental illness? Do you suggest any medication?
Psychiatric medications are actually very safe. Okay, all the SSRIs we have. Firstly, melatonin has come up, which is one of the safest. In fact, melatonin has been prescribed as an immunity booster also. So if you actually have issues, psychiatric issues, should not postpone it. If you feel uh, hopelessness, helplessness, worthlessness, okay, suicidal ideations, definitely take medications. It is like any other medication. In fact, much safer, can be taken safely over a long-term issue. Talk to an expert. If you're having certain problems or side effects with the medicines, the doctor, the psychiatrist would know. But if you are having a proper psychiatric illness, it should be needed, taken care of. Doctors who are having cardiovascular issues, they continue antihypertensives, they continue ecospirin for lifelong, they continue the lipid lowering agents lifelong. So why not psychiatric medications? If you have problems, psychiatric problems, take medications, come out of it, and you'll perform better. And obviously, my advice is, if you have a problem, tackle it, don't languish with it, don't postpone it.
So, doctor, before we wrap up this really, enriching session, I have one last question. Even though you have explained everything, I mean, there are no complaints about that. My question is, what would be your take-home message to the viewers?
Yeah, as I said, mental health is it should be like more than mental health. We should talk about mental well-being. It is something which is very holistic. Small steps, taking care of your body, taking care of your social relationships, having good, healthy relationships. All right. Uh, Being aware about psychiatric illnesses in ourselves and amongst our close ones, amongst our patients, uh, and being proactive about it, uh, remove the stigma, increase awareness, small steps, yoga, meditation, something which is helpful. All of us should know, or we should have a passion. Somebody has sports, somebody has music. Should always have one passion: trekking, traveling, exercise, whatever. Indulge in it at least, I'll say, 3 to 4 times a week. And once you're doing that, take away all your worries. And this actually helps reset and rejuvenate ourselves. Uh, uh, Wish you all the best. I'll end now. Thank you.
Thanks a lot, Dr. Anurag, for taking out time for our viewers. It was really, really very interesting and enriching, and I learned a lot personally as well. So we look forward to having similar sessions with you in the future. And to our viewers, I would say watch out for this space. If you find these interesting and helpful, and please like, subscribe, and to the Practo YouTube live channel. Thanks a lot, everyone. Goodbye for now.
Pleasure for me.